right. So thank you so much, Kelly, for agreeing to come onto the podcast. Breastfeeding is always a hot topic. So I know this is going to be a popular episode.
Thank you so much for having me. I'm thrilled to be here and chat about my favorite subject, which is the very hot topic of breastfeeding.
All right. Awesome. I love it. So why don't you start off a bit by telling us a bit about yourself and your work and your family, if you'd like.
Yeah, so I am a nurse and a lactation consultant in IBCLC, which stands for International Board Certified Lactation Consultant. Okay. And I am the mom of two, and I'm married to my college sweetheart, and we live in Maryland. My kids are almost 12 and almost 9. So I'm through the busy days of infancy and toddlerhood and breastfeeding, but my own struggles with breastfeeding are really what got me into this field, because I, like so many moms, really kind of went into my breastfeeding experience pretty blind, with a lot of blind hope. And, you know, that's really what my work is about now, is preparing people for what you really need to have an empowering breastfeeding experience.
Sure. Awesome. And I always call breastfeeding a labor of love, because you do it because you love your children, but sometimes it can be challenging. So we're going to get into some help for folks today. And I'm also too past that like toddler breastfeeding stage. Thank God, my children are 13 and 15. So now we deal with other struggles.
I know, that's what I tell people. I'm like, it doesn't get easier, it just gets different.
It just gets different. All right. So you mentioned that you are, and I'm looking at my notes to get it right, IBCLC. So what does that mean to be an international board certified lactation consultant? Did I get that right?
Yes. And yes, you did get it right. And it is a mouthful. So an IBCLC is really the highest level of credentialing in the lactation field. So really anyone can call them like a breastfeeding specialist or a lactation counselor. Like, these words aren't as regulated as regulated as IBCLC is. So IBCLC, you need college level credits, and you need over 500 clinical hours of hands-on breastfeeding assistance.
Oh, I did not know it was that much.
It's a lot. There are different pathways. Some people will enter like I did, where I was in a hospital as a mom baby nurse and got my hours that way. Some people will do it via La Leche League hours. Some people will have a mentor. So there's different ways of doing it. But when someone is an IBCLC, you know that they have a certain baseline level of education and a certain amount of hands-on clinical hours supporting breastfeeding families.
Gotcha. And it's not that, you know, everybody has different levels of expertise or experience or whatever. And it's not that I'm poo-pooing people who don't necessarily do certification, but there's something to like going that extra step and getting that certification and getting that education. You know that you are getting information from someone who like put some thought and some effort and is very serious about the work.
Yes, absolutely.
Yeah. And do you still practice as a nurse?
So I left working as a nurse. So I was a nurse for about 10, 11 years at the bedside, really busy postpartum hospital as a mom baby nurse. And then I transitioned to being an IBCLC at the bedside. And then during COVID, I transitioned to opening my private practice. And then that sort of segued into what I do now, which I do some one-on-one with clients, but I'm mostly just focused on educating on Instagram and in my breastfeeding course, Boob School. So
awesome.
One of those accidental gifts of COVID, where with all the virtual support that happened, it allowed me to transition to doing this.
Gotcha. Okay. So let's hop into learning about breastfeeding. So when is the ideal time that you recommend clients start thinking about or getting prepared for breastfeeding?
So I saw somebody posted this a couple days ago, and I'm like, that is a great way to talk about it. A little bit at a time over the whole course of your pregnancy. You know, we don't want to wait till we're 36 weeks and then try to shove hours of education into our brain. We really want to be learning about it the entire time and hitting on the important points, and then being able to kind of brush up on them maybe closer to birth, but really that's where we don't overwhelm ourselves and we can actually retain some of the information, because parents usually, I mean, you know this as an OBGYN, parents usually decide if they're interested in breastfeeding very early on. Usually in the first trimester, they've decided if they're interested. So I really think, you know, not soon after that is really where people should start the process of getting educated.
Awesome. Okay. Yeah. I never really thought about that. And it's not something that we even really necessarily bring up in the prenatal conversation until the third trimester when we're talking about like getting a breast pump and that kind of thing. So that's great that, you know, you say start early. It doesn't have to be overwhelming, right? Like it doesn't have to be like you're reading every single day about breastfeeding or anything like that.
Not at all. But like if you think about when your breasts really are starting to get ready for breastfeeding, you're producing colostrum as early as 16 to 22 weeks gestation.
Which freaks people out sometimes.
Well, right?
It happens.
Your body is preparing pretty early. And so what it's all about is, you know, starting to kind of dip your toe in, finding sources that you can trust and kind of their approach resonates with you. And then I believe just sort of like pacing that education out over the course of your pregnancy. So you're not having to like get to 38 weeks and realize that you don't know anything. And then you're trying to kind of shove it in overwhelmed. We really want to pace it out over the whole course.
Sure, absolutely. Okay. So then what are the 2 or 3 most important things that you think folks need to do in order to prepare and be best set up for breastfeeding?
So, you know, 2 things that I like people to kind of always keep in mind is we don't want to learn to build the plane as we're trying to fly the plane, right? It's very difficult for you to retain new information after you've given birth. I can't tell you how many times I would be in a postpartum room. I'm sure this has probably happened to you, and you're there to educate a mom, and the poor thing cannot keep her eyes open because she's been up for 24 hours with the hard work of labor. And so you're not really primed to learn a ton during that time. So it's really about setting yourself up, also that you're not reliant on all the education you need to happen in the hospital, because it is you know this, I know this, it is a busy place. It is fast turnarounds. You're going in and rounding on these patients. I'm going in, the pediatricians are, we're doing lots of things to mom and baby. And so it's really not in your best interest to rely solely on like the idea that they're going to teach you everything you need to know in the hospital. Same with birth. Like you're going to have a better experience if you go into this with really some foundational knowledge. So really those 2 things is, you know, I want moms to understand how their bodies work, so how milk production works, so they're not necessarily relying on someone to come around and teach them the basics. They really understand what they need to do to help bring their milk in and support their baby.
Gotcha. Okay. So along sort of similar lines, what are the most common challenges that you see when people get started with breastfeeding? Like 2 or 3 things that you see come up time and time again. And what are things to help with those challenges?
Yeah. So I think the first thing I would say is just a lot of parents kind of have this idea that their baby is going to be born, going to be put on their chest, and they're going to scoot their bodies over and latch on. And that does happen sometimes, and it's wonderful when it does. But there are some babies that are just not stellar breastfeeders for a variety of reasons. Maybe a long, difficult labor. It, you know, could have been, you know, any sort of resuscitation measures. And what a lot of parents don't know is what to do if baby isn't latching in those first hours, and it's incredibly stressful. So I teach a lot on hand expression and practicing hand expression in the last days of pregnancy, days and weeks of pregnancy. So the way this works, so if you have a low risk mom, right, a mom who's cleared for a vaginal delivery, she's allowed to have sex, she's allowed to raise her oxytocin levels, she can practice hand expression, which is literally using your hand to practice expressing drops of colostrum. Now, some moms will get drops of colostrum and even decide to bring those with them to the hospital to supplement baby. Some moms, that doesn't appeal to them. But even
Sure.
practicing it, because what studies have shown is that if moms hand express within the first hour after birth, they end up with 160% more milk at 6 weeks. It's like a crazy bang for your buck.
Crazy.
Yes, because of that big hormone shift that happens when that placenta is delivered. And so the early expression of drops of colostrum immediately after birth in the next hours and days while you're learning to latch your baby is one of the most protective things you can do to help build a great milk supply. So
I did not know that. Okay.
I know, and so many, it isn't quite, like it's becoming more popular, but it's not necessarily mainstream yet.
Sure.
And a lot of moms think, will see things on Instagram and maybe be like, I am not bringing colostrum with me to the hospital. No, thank you.
Yeah, and that's like, right.
Which is totally fine. But again, like we talked about earlier, you don't want to wait for me to come to teach you something when you're exhausted and overwhelmed, and you may not even have a lactation consultant there in the nights or the evenings or the weekends. So I want to empower you to know just what to do if your baby isn't latching immediately. So I would say that's one thing, kind of this expectation that baby's going to go on and start breastfeeding like a champion. And then I think the other thing is sore nipples. Because breastfeeding, although it's really instinctual for babies and there's lots of natural reflexes that are hardwired into their brain, parents have to learn how to do this. And really, we learn as humans best by watching other people breastfeed. And many moms
which doesn't happen in our society.
Right. And many moms have never seen that, and back when we were living in communities where we were multi-generational homes and lots of women together, it would have been easier for moms to see this, see what it's actually like to breastfeed a newborn. Because a lot of people have seen someone breastfeeding a 1-year-old or something, or a 6-month-old, but not many people have seen what it's like to breastfeed a newborn baby. And a lot of moms also think that pain that comes with early breastfeeding is expected, or just part of like the cross that we must bear as women and mothers. And it's really not. It's common, but pain is your body's way of telling you something isn't right. So, if your nipples are painful, cracked, bleeding, traumatized, usually the most common reason for that early on is a shallow latch. So understanding what you can do to help your baby to open really wide and get latched deeply to the breast so you're not having to deal with any of that is a really helpful thing to go into your birth knowing. Okay.
And what are your thoughts on to try to manage those sore nipples? Do you recommend I know lanolin cream is pretty common, or ointment? Is there anything in particular that you recommend?
So the studies on lanolin really aren't that good. It's actually not very effective, although it's been around for a long time. What I recommend are a product called Silverettes, and they're silver nursing cups. And in medicine, silver is antifungal and antimicrobial. They'll even use it in some wound dressings. And what we know about how wounds heal is moist wound healing works really well. And Silverettes just cover your nipple and you actually express some drops of your own breast milk. And we know breast milk is incredibly healing. It's full of antibodies. It's this magic substance. So if we just kind of create this environment for healing where your own breast milk can do the work, that is what I generally find to be most effective. And then you're not having to add any ointment or prescription cream. I really find it to be super effective. And with the moms that I work with in boob school, I just kind of across the board recommend people get these, bring them with you to the hospital, and it can really help prevent and treat that early onset nipple pain.
I have never heard of that. So you learn something new every day. Can you still breastfeed with them on?
You just wear them in between nursing sessions.
Interesting.
In your bra in place of a nursing pad. Yeah, they're a pretty awesome product. I've seen them work really, really well. And again, then you're not having to put anything on your nipples that's going in the baby's mouth or whatever. It's not sticky. It's literally just your own breast milk.
Gotcha. But the lanolin is not harmful, is it, that you're aware of?
It's not harmful. It is derived from wool. So some moms can be irritated to that, especially if you have a a wool sensitivity, but really the
Sure.
studies have just shown that it's not any more effective than something like your own breast milk or coconut oil or something like that.
Got it. Got it. Okay. Okay. So let's talk about any other misconceptions, like things people say about breastfeeding that you're like, I really wish we could like put those misconceptions and lies to rest. Are there 2 or 3 or anything that you're just like, this is not true about breastfeeding?
Well, we already said it's not easy. We already said you can't depend on them teaching you in the hospital. I would say one thing that I hear a lot is that, you have to, if you're dealing with clogs or pain in your breast, that you're really supposed to dig in to like get the clog out.
Right.
And what we know now about how clogs and mastitis works in breast tissue in general is really that it's light touch that helps move that fluid up and into the lymph system. So we should never be touching our breasts harder than how we would like put lotion on our baby's face.
Oh.
So really, again, that light touch up towards the armpit to these lymph nodes in the axilla is really what helps reduce engorgement and can help with clogs and mastitis as well.
Nice. I had never heard that before. And then what about like misconceptions about like, you have to feed the baby on a specific schedule or this, that, and the other. What about that?
Yeah, we really want, especially in the early days, to be feeding baby on demand. So whenever baby wants to eat, and newborns are designed to feed a lot. They do something called cluster feeding, usually in the evenings. And that's those times where you just park your butt on the couch in front of some show you're going to binge watch, and it feels like you're breastfeeding for hours.
Right.
And babies really are, that's how they're designed, to have some feedings closer together and then have a longer stretch. And another common thing that we hear is feeding baby like for 15 minutes on one side and 15 minutes on the other.
Right.
That's also not true. We want to let baby finish one breast. So let them fully finish that breast, burp, and we're going to offer the other. So first breast is dinner. Then we burp and we offer dessert, which they may or may not take. Some babies just only ever want one side. And for some babies, it can change over the course of the day if they want one or both sides. But we definitely don't want to be looking at our clocks. We want to be looking at baby's behavior at the breast.
Got it. Okay. So lots of people are going to breastfeed at the breast, and some people are also going to pump. So what are your thoughts about when to introduce pumping, and then some suggestions to make sure pumping goes well?
Yeah, so definitely I'm someone who believes pumping is breastfeeding. Exclusive pumping is a way, anytime your baby's getting your milk. Usually if things are going well, like if you're not needing to supplement or anything like that, you're not wanting or needing to do bottles early on, you can wait, until a month. And just really, I'm always telling the moms I work with, like, team less work in the early postpartum days. So if we can take one thing off your plate, wait a little bit longer till, you have your footing, and then introduce the pump. Okay. One thing I will suggest is I talk to my moms about measuring their nipples for their phalange in pregnancy, at the end of pregnancy.
Okay.
Now, and it may change slightly just with fluids and some fluid shifts and some engorgement. But really the reason is we don't know how soon you're going to need to pump. Some moms can wait till those 4 weeks. Some moms, if your baby is jaundiced in the hospital, you may need to start day 2. And so if we know that, I measure it, 37 weeks and I realize that my nipple diameter is 15 millimeters, I'm going to know that that 24 millimeter phalange that they're going to hand me in the hospital is not going to work for me. And many hospitals only have one size phalange or maybe 2 sizes of phalanges to offer you. So you can actually get phalange inserts that you can just order on Amazon. They're less than $20. Throw them in your hospital bag. So then you have a correct size to bring with you to the hospital if you were needing to pump early on postpartum.
Right. Okay. I have never heard of anybody measuring their, it's more like a trial and error, just stick it on there and see what happens, for lack of a better way to put it.
Yeah, so we want it really can impact how comfortable the pumping session is for the mom and how effectively they're removing milk. And moms can actually really damage their nipples if they're using a flange that's very poorly fit. And this is something that I will tell you, this is something that's really changed in the last couple of years. Like it used to be when I was at the hospital, to be like, all right, here's 24, it looks okay.
Right.
And now we're realizing like, oh, actually the size that we're giving moms really does impact their pumping experience and how their nipples are feeling. And so it's important to have the right size.
Okay. That makes a lot of sense. Are there any particular pumps that you recommend? I mean, pumps are like a whole new level now from back when back when I was pumping. Yes, it was like the Medela, and that was like the gold standard. But now there's tons more. There's the hands-free ones that you can do while you're doing other things.
So the hands-free ones like the Willow or the LV are more what we call secondary pumps. So they are great in a pinch. You can use them some of the time, but for most moms, those aren't going to be strong enough to be what you would use as your full-time pump, especially if you are primarily pumping. So a really good, solid at-home pump that's very popular is the Spectra. That's kind of a good workhorse that a lot of moms can get through their insurance company. Pumpables is another pump that I love. That's something that's really small and you can be mobile with it, but it's still a strong and effective pump. And those are probably my two faves. But the pumping rabbit hole is large, and there are accounts on Instagram devoted just to exclusive pumping, and there are millions of pump reviews on there that you can dig through.
Yeah, as a matter of fact, I have a guest who will be coming on, and all she does is help with pumping. So stay tuned. Stay tuned for that. Okay, so if people are having trouble with breastfeeding, particularly, actually, let's talk about both sides, because actually people think that oversupply is not a problem, but it actually can be a problem for people, and a very uncomfortable one. So what do you do when you have oversupply? And then what about like supplements, teas, cookies, things like that for undersupply?
So with oversupply, that's definitely something that you want to be working one-to-one with a lactation consultant, because you really want someone that can be watching you closely, because it is a dance that we have to do we want to allow milk to stay in your breasts a little bit longer, because that's what tells your body to downregulate your milk supply. So it's milk sitting in your breast that tells your body, okay, we have more than we need. You have a protein that builds up called the feedback inhibitor of lactation. But we want to watch you really closely, because if we do that too much, we can raise your risk of mastitis or clogs. So you want to be working closely with a lactation consultant and possibly doing something called block feeding, where we have you only feed from one breast for a certain period of time. And then sometimes if I have a mom who has a huge oversupply, say she's expressing 70 ounces a day, and we know her baby's only taking 25. Sometimes those moms need some herbs or even something like pseudoephedrine to help down-regulate their milk supply enough. So it is really something that, if you know you have an oversupply, I would tell you, like, that's something where you want to be working hand in hand with someone who really can walk alongside of you. It's not something that you want to just be like trying this weekend on your own, because it can make things worse if it's not managed well.
Got it. Okay. And then undersupply.
So undersupply, two things. The key with low supply is getting to the root cause. So there are two kinds of low supply. Something called primary low supply, and those are the cases with moms who may have insufficient glandular tissue, or maybe PCOS or hypothyroid. They may have a medical condition that impacts their ability to make milk. And there's secondary low supply, where maybe baby is tongue-tied, or mom didn't get good breastfeeding information early on, there was a lack of stimulation, something along those lines. And you can have a combination of both. But with low supply, we really want to target how we're treating you to what's going on. Because if you are a mom with insufficient glandular tissue, you can eat every damn cookie in the world, and you can be feeding your baby. And so I am all about not having people on the the hamster wheel of constant pumping and triple feeding and all of that. So working with an educated, compassionate IBCLC and your physician to maybe get blood work and dig a little bit deeper to see what really could be going on underneath of things is super important. Cookies and herbs, we know they did a study last year about cookies, and I love cookies. And what they found out is they don't really help. So if you think about galactagogues, which are herbs that have been shown to help with lactation, the least concentration of them are going to be in things like herbs, smoothies, and teas. You can take capsules or tinctures, and those are going to have a much higher concentration of whatever that herb is. But again, even that, the studies are a little bit, but with some of my moms who are maybe like right on the edge, we know that they are maybe going back to work and they just kind of want to bolster things a bit. It can certainly help. And for some people, just doing something and kind of placebo effect, like you think it's going to help, that lowers your stress level a little bit, and that might actually help bolster things. But the studies for herbs in and of themselves, and certainly for cookies and stuff, really isn't very strong.
Okay, so probably won't, there's no evidence that it helps, but it probably won't hurt, I guess.
Yes, and the thing that's tricky about herbs is it's very trial and error. We don't quite know what is going to work for you until you try it. And those things they're expensive. So before I recommend any of those with people, we're going for the low hanging fruit. We're going to make sure that baby is efficient, that you have a well-fitting pump, that you're emptying your breast effectively. Because if you're not doing those foundational things, you can eat all the cookies, drink all the teas, takes all the capsules, and it's not going to make up for that.
Okay, that makes sense. All right, so say someone is having trouble, or even they want to establish a connection with the lactation consultant even before, during pregnancy. That's actually one of the things I say is like try and line up help before you need it, actually. And if you don't need it, great, but if you do, you have it there. So if someone is looking for a lactation consultant, what are things that they should look for? What are 2 or 3 questions to ask?
I think asking someone's experience level, when you meet them, what their experience is and kind of their general philosophy. One thing that's helpful now, in the world of Instagram is you can there are many lactation consultants that have social media accounts, and you can sort of feel someone's vibe out and kind of decide if they might be a good fit for you. And, looking for support groups. In my breastfeeding course, we also have a live support option. So you also get a Facebook group similar to yours. So people can come back and ask questions. Because, what really gets us is those new moms are those 2 a.m. Google spiral dumpster dives. And, if people have a place that they can trust to go and ask questions, it really helps. But yeah, you can also look at what your insurance company will cover in terms of lactation support. And I would advise you, reach out to those lactation consultants who your insurance cover, double check that that's up-to-date information. And sometimes you can book something ahead of time for a couple weeks after you deliver, just like, you have well visits with your pediatrician. It's always a good idea to, have a check-in, ask your questions, and, breastfeeding is one of these things that really changes a lot over the course of your breastfeeding experience. What would be a problem with a 4-week-old is totally normal with a 4-month-old. So, having a place that you can go to ask those questions over the whole breastfeeding journey is really helpful and lowers parent stress a lot.
Gotcha. And I imagine you might have people who have different philosophies. Maybe some people are like, we're going to breastfeed at all cost. And, maybe that's not what you want. Maybe it is. Maybe you want someone who's a little more flexible, or like if you are just tired and things aren't going okay, that they can help you feel good about whatever choices you make to feed your child. So you want to make sure you have that good fit. And I assume if it's not a good fit, then find someone else.
Yeah, absolutely. I mean, I think that's the beauty of being able to kind of find a provider, who really aligns with your feeding goals. And I tend to be somebody who's I am more than anything else, for anyone I interact with, whether it's in a consult or in boob school or on Instagram, it's incredibly important to me that they know that I see them and that breastfeeding is complicated and there are two humans involved. And it is not just about how bad you want something. That is not how this works, because I have dealt with moms over the course of my career who have wanted this so badly and it didn't work out for them. Right. And I want them to be able to access so much self-compassion and self-love. Sure. Because that's really, at the end of the day, what your baby needs is a parent that is able to treat themselves with kindness and connect with their baby. And breastfeeding, again, is not an all or nothing thing. I am not a believer in that. There are so many different ways to do this, and there should be, because we're humans and we need different things, and our babies may need different things too.
Absolutely. Love it. Love it. Love it. Love it. So as we wrap up, what would you say is the most frustrating part of your work?
Oh, geez.
And I ask my guests all these questions.
I think the most frustrating part of my work is just how much misinformation is out there. Sure. Sometimes it feels like it's like whack-a-mole, like the things that come up on Instagram and I see circulating on mommy blogs and these people that, are on Instagram as experts, and their breastfeeding knowledge really is, I breastfed a child, which, not that they don't have anything of value to contribute, but it's not the same thing. And I think you probably can feel the same way. 100%. So that's definitely the most frustrating thing.
Yes. Yeah. Like it's not that you can't learn from other people who have done this, and you should, but that should not be like your only source of information. Experience matters in this arena, I think, in particular, definitely for what I do for birth. Being a part of so many births brings a wealth of knowledge and experience that just is not replaceable. And it's the same thing when you sat with so many women, and I've seen this, I've seen that, I've seen this tweet, that experience just brings so much. So it's not discounting what other people are saying, but don't rely on that as your only source of information. That's my 2 cents inside note to that.
Absolutely.
Yeah. So on the flip side, what is the most rewarding part of your work?
Oh my God. I'm just somebody who is amazed by moms and babies every day. And I think to watch a mom learn to trust herself, is one of the most beautiful things to witness in the world. And when I work with a mom who maybe breastfeeding isn't going exactly how they thought, but they're still able to treat themselves with such fierce self-compassion, that just, it blows my mind, and I'm really proud of it.
Yeah, I love that. So then what is your favorite piece of advice that you like to give to expectant moms or expectant families?
I think build your community of support now. This is the time to access what is around you in your community, whether that's on Instagram or in your physical community. Find your pelvic floor therapist, find your lactation consultant, find your mom mental health therapist that's out there in your community. So really, this is the time to gather those resources, so they're right there at your fingertips when you need them.
All righty. And speaking of resources, where can people find you? Your website, your Instagram, your class, all of the details. Give it to us.
Yeah, so you can find me on Instagram at The Balanced Boob. And my website is the same, thebalancedboob.com. And then you can join us in Boob School, which is my breastfeeding class for expectant parents and parents that are already in the thick of it. Really, we work to support you in all the things that can come up with breastfeeding. So,
okay. Awesome. Well, thank you so much. And of course, we'll link all that in the show notes. Well, Kelly, thank you so much for agreeing to come onto the podcast. Super helpful information. Thank you.
Awesome. It was so wonderful to chat with you.
All right.